Hi, I'm Lori.
And I'm Tiffany, and we're the Pelvic Physiotherapists here at Rebalance.
What is pelvic floor physiotherapy?
Pelvic floor physiotherapy is the assessment and examination of the muscles of the pelvic floor. These muscles sit at the bottom of your pelvis like a big basin, and they help with providing structural support to the pelvis, as well as having other functions such as helping us with our continence and sexual function. These muscles span from your pubic bone up at the front, so this is your pelvis here, all the way to the tailbone at the back. And so they sit along the bottom of the pelvic floor.
What occurs during a pelvic floor exam?
So during a pelvic floor exam, we take a look at everything generally from your diaphragm all the way down to your knees. So this takes a look at all of the muscles that may attach into the pelvis and might influence your pelvic floor. We'll assess the fascia and the muscles around that area. And then what makes a pelvic floor exam different is that we do assess internally, meaning we assess vaginally and rectally the muscles of your pelvic floor. So we do this just using our fingers. We don't use a speculum or any instrumentation. And we feel for muscle tension and tone. We're looking for your strength, so your ability to contract and relax those muscles, as well as looking for other things such as pelvic organ prolapse.
Does pelvic physio hurt?
It certainly isn't intended to hurt, but what people are usually coming in for is, or frequently are coming in for, is pain related. And so we do find areas of sensitivity, and we're going really gently at those.
What conditions can pelvic physio help with?
Some of the ones that are most commonly considered are during treating pelvic dysfunction during pregnancy or in that postpartum period. We help to treat urinary incontinence, and this can include stress incontinence, so when someone has urinary leakage with a cough or sneeze, as well as urge incontinence, so when you have difficulty actually getting to the washroom on time without leakage. What some people don't consider is we also help to treat with bowel dysfunction, so sometimes constipation or pain or discomfort with your bowel movements. Quite often pelvic physiotherapy can help with pelvic girdle pain dysfunction as well. This can happen during pregnancy, but a lot of people also experience discomfort or difficulty with penetrative intercourse. And what some people don't consider is that pelvic physiotherapy is sometimes used in our male populations as well. This can be used for after having a prostate surgery, after prostatectomy, or when people have pain or discomfort, often associated with a bacterial chronic prostatitis.
How do I strengthen my pelvic floor?
Surprisingly, not everyone needs to strengthen their pelvic floor muscles. Some people actually need to release them, to relax them. So I would say more than half of people actually need to relax their pelvic floors. It's surprising how much tone and tension we carry. It isn't all in our shoulders. Lots of people carry it in their pelvic floors when there's stress or anxiety going on. So strengthening pelvic floor can be the sort of classic Kegels and lifting up. The elevator exercise is a classic one, but it depends on what your issues are, how we customize those, and whether we want a nice little quick release or whether we're looking for more endurance.
What exercises does a pelvic physio teach?
A lot of them are internal exercises. So we teach you how to contract your pelvic floor properly, or as I said, relax it. Sometimes you need to strengthen the big muscles from the outside. Sometimes you need to relax them. There are abdominal exercises, diaphragm exercises. So it really varies according to the condition, but you'll always go home with homework.
What training does a pelvic physiotherapist have?
So all pelvic floor physiotherapists have the same training in the sense that we are all registered physiotherapists. So we all have a master's or bachelor's degree in physiotherapy. But in order to allow us to do an internal examination of the pelvic floor, both vaginally and rectally, we've all taken additional training, often in the form of weekend courses, to be able to specialize in learning about incontinence, sexual dysfunction, and bowel dysfunction.
To learn more about pelvic physiotherapy and to see if it's right for you, give us a call. We look forward to seeing you soon.